Hi there, my name is Dr. Kira Gecht and I'm a dentist in Sarasota, Florida. My practice, Simply Smiles, is located on the corner of Stickney Point and Swift. So look me up. I get a lot of questions about root canals. It's one of the most common procedures in dentistry. So I'm here to answer some of your questions. So the root canal is the space where the life structures of the tooth, such as nerves and blood vessels, are located. You know, oftentimes we refer to root canal as the therapy. So it's root canal therapy. What we really do at this point is, unfortunately, due to bacteria, often it's cavity, the bacteria get inside that space, what we call a root canal, and make the tooth sick. And guess what? I want to save the tooth. So what are we going to do? We're going to clean all the sick tissue, all the sick stuff from the inside the tooth, from the root canal, and seal it off so we can save the tooth. Ultimately, root canal therapy is the procedure we do to save the tooth. Number of signs and symptoms when the patient needs a root canal. The most obvious one is pain that just not go away, and especially when it gets worse at night. Because during the day, we're busy, we're moving, but when we sit down, especially lie down at night with ourselves and our tooth, that's when it really hurts. I get that all the time. Sometimes there's a situation where the tooth is not having the symptoms. So just relying on the symptoms is wrong. This is part of the reason why we as dentists want you to come in and get your regular checkups, because we don't want to have a infection brewing in your jawbone without you really knowing that. There are multiple specialties, multiple different doctors that perform root canal therapy. Sometimes it could be your dentist who sees you for your cleanings, for your fillings, and regular stuff. But sometimes he or she may choose to refer you to a root canal specialist. And you know what? I can go through a big list of why, but the first stop is go see your dentist, go see them on a regular basis, so you can possibly, first of all, avoid root canal. Patients ask me oftentimes, should I get this procedure done right away or can I wait? Well, we don't want to wait. This is when I'm going to get serious with you guys. We have a tooth that has infection, where the bacteria is multiplying and causing pus pockets forming in your jawbone. Or like jawbone here, or imagine this, here's where the tooth is, here's where my sinus, here's where my eye, and this is my brain. So no, we're not gonna wait and let the infection that's brewing in our body get worse. Root canals, unfortunately, got a bad reputation. You know, there's always the horror stories. I was in so much pain, and root canals are painful. Done properly, root canal is not painful. What painful is avoidance and neglect. Unfortunately, when we let things go, when we don't listen to our bodies and allow the infection to get bigger, that's where the pain starts. Not the procedure itself, it's the consequence of the infection. That's what causes lots of pain. The most important thing during the root canal therapy is for my patients to be comfortable. First, and the most common way we do it is we're doing with the local anesthesia. Sometimes I have a patient who has waited, and now the infection is bigger. Getting the patient comfortable becoming that much more difficult. So we sometimes can use something like nitrous oxide just to take the edge off. My job is to make this unpleasant experience, this thing that got a bad reputation, make it easier for my patients. Listen, sometimes I may recommend the sedation. Whatever it takes to get you through this procedure with as much comfort as possible and with least amount of discomfort. Also, my patients get a lot of questions of what exactly you guys doing? What's this magic that's happening? How you get rid of the infection? So number one thing is for us to remove all the infected tissue from the inside the tooth, from the root canal space, clean it up. We use a series of irrigation and washing out of the infection. And then we placed a special sealer inside the tooth to make sure that the infection doesn't come back. Very often, root canal therapy is done in one visit. But sometimes, when the infection is quite extensive, we may need to do it in multiple visits. But usually, 1 or 2 visits is sufficient to get the job done. Very often, along with the root canal therapy, the doctor is going to prescribe to you a crown. Let me explain to you why crowns are very important. When the tooth loses its blood supply, that's what happened during the root canal therapy. We have to remove the diseased tissue and then put a special sealer inside the tooth. So now the tooth doesn't have a blood supply and it is not vital or not alive. So what's basically happening? Let me give you an analogy. So we have a tree. Listen, I was a child, you tried to hang off the tree and you hang it off, all good. And guess what? I let it go and it bounced back. It has resilience. It has a little bit more elasticity. But the tooth essentially does the same thing. So when the tooth is alive, it's stronger. When the tooth is now like non-vital, doesn't have the nerve inside of it, it becomes brittle. So now let's do the same experiment. Let's take a tree branch that is dead. Boom, it breaks. That tree branch is good enough to do a fire, but it's just doesn't have the elasticity that the tooth becomes also brittle, just like the tree branch. So this is why, to protect the tooth from crumbling, protect the tooth from breaking, we're going to put a crown on it. And it's basically a protection that we put over the tooth. And listen, just like with any procedure, I've been asked, do I have another choice? Is there another option for me to not to do root canal? It just really depends. If the nerve is infected, if the tooth is infected, to save the tooth, there may not be another option. Some people choose to remove the tooth, but I would honestly get you to examine it. Nothing is better than what God gave you. Your natural tooth is a natural tooth. So if your doctor tells you that this is going to be if this is going to be a successful procedure, and by doing root canal therapy you can save the tooth, that would be my option. Only when all the other options are exhausted, then yeah, let's talk about other replacement. Now you're missing a tooth. Now your doctor might recommend a dental implant, which is basically an artificial root. Artificial root is never going to be as good as your natural. So that's some other options that you might have. But first option is always going to be save what you got. Unfortunately, sometimes not all root canal therapy procedures are successful. And it's hard to predict it. And guess what? Sometimes I have a patient goes like, listen, I have this bubble, or in layman terms, gum boil, a bubble, a pus bubble, formed right next to the tooth. The first thing you need to do, you need to see your dentist. And the dentist can determine whether or not this is, how extensive is the infection, and if the tooth can be saved. Unfortunately, despite your dentist, if I'm your dentist, my best efforts, or even a specialist, the tooth can, after root canal procedure, still get reinfected. Reasons can be numerous. It is biology, after all. You know, we're dealing with the live tissue. We're dealing with bacteria. And there could be multiple reasons. One of them could be that the tooth maybe didn't get a crown in time, and now the tooth is cracked. Maybe the tooth had multiple canals. Listen, look at the tree. You know, tree has maybe one branch, but multiple roots. And that could be another reason why the root canal got infected again. After the root canal therapy, your dentist will 99% of the time recommend to put a crown on the tooth. The reason being is the tooth is doesn't have as much support. And to reinforce that support, sometimes you have to rebuild the tooth. And if the large portion of the tooth structure is missing, then yes, you need to do a crown. Because guess what filling is? So, people say, well, can you just fill it? Well, the whole word filling means you fill something in. But if the tooth is really compromised, then you need to do something bigger. That's why you put a crown on it, to avoid root fracture. Sometimes when infection is very extensive, it causes a lot of bone to be destroyed by the infection. But once the infection source is eliminated, very often we see improvements when the bone where the infection was grows back. Root canal therapy is commonly, also good news, covered by dental insurance. But to get you more information, you gotta call our office and have my friendly insurance coordinator really give you a full understanding on what really is the covered or uncovered procedure by your dental insurance. But first and foremost, we're here to save you teeth, to get you healthy, and not always does insurance going to have the same objectives as we do. So all I want you guys to do is think about why and what do you do the most commonly in every day. What do? We eat. And when you're on vacation, we're on a cruise, we don't eat 3 times a day, we eat at least 6. So save your tooth. If necessary, if your dentist recommends a root canal, do it. Save the tooth so you can enjoy your vacation, you can enjoy the food, and that's why we're here. I'm Dr. Gecht, and I support this message. My office is Simply Smiles, and my phone number is 941-921-4654, and I hope you're never gonna need a root canal.